data about dialysis is a difficult situation, or any disease process can be hard on someone. And how do you make the best determinations? We're talking about. What's your thoughts on it, Joan?
Well, it is difficult. When somebody's failing, how does the average person determine? I mean, how do you now I've
Sure,
lost my
sure.
place.
How do you decide what the next
How,
step
how,
should be?
how do you decide? When the doctor has some recommendations, because they've seen a lot, they've had a lot of education, they've seen a lot of people in practice, they've seen how things progress. So you have to take their advice. You have to weigh their advice very strongly. At the same time, the person knows this person intimately, and they're one, either not willing to let go, or two, know that they have this very strong constitution and are still fighting. And they're not ready to give up yet. And I think that's maybe part of it, is when is the person who is failing ready to give up? If they're still willing to fight and still want to fight to stay alive, should we allow them to do that? Or should we encourage them to give up?
Yeah, I think these are good questions. So, my feeling is that if people have fight left,
They should keep fighting.
we should try to find solutions if it's reasonable, as long
If
as
it's
they're not
reasonable.
not suffering.
Not as long as it's not excessive.
On the other hand, if people's expectations are
Right.
much higher than we can deliver,
Right.
we have to sort of be honest
We
about
have
that.
to be honest. Yeah.
And
It's not beyond. It's not within our realm to be able to do things miraculous.
the other part of the equation too, and it's complicated, is that some doctors don't want to give too much advice, want the patient to make up their minds. And you were telling me that doctors have lots of experience.
Yeah.
I think it's good to ask your doctor, is that, listen, if you're in my shoe, this is my loved one, what would you do?
Yeah.
What's your thoughts about that?
No, I agree. I agree. It's not reasonable.